Good afternoon. Welcome to the Multi-Ministerial Task Force Press Conference. On our panel today, we have Minister Gan Kim Yong, Minister Lawrence Wong, Director for Medical Services Professor Kenneth Mak, and CEO of Tan Tock Seng Hospital, Dr. Eugene So. May I now invite the ministers to begin with a few words. Minister, please.
Thank you. In the last few weeks, we have seen a worrying trend of an increasing number of locally transmitted cases, and we have seen the emergence of several clusters. We are particularly concerned about the cluster linked to the Tan Tock Seng Hospital. Upon the detection of the first case, MOH and Tan Tock Seng Hospital worked together to quickly identify all potential close contacts and test and isolate them so as to contain the spread as quickly as possible. Tan Tock Seng Hospital has also strengthened the measures to contain transmission, including locking down all affected wards and testing all the patients and staff in the wards, whether or not they are symptomatic. The aim is to really uncover any hidden cases that may be asymptomatic so that we can effectively contain the spread. Staff and patient movement in all the main wards has been minimized, and no visitors are allowed into the hospital except for critically ill patients. I will invite CEO Dr. Eugene So shortly to share more about the measures at the Tan Tock Seng Hospital. We know that such measures have caused inconvenience to patients and their families, and we understand your anxiety to want to see your loved ones who are warded. Tan Tock Seng Hospital will allow, on a case-by-case basis, limited visitors for patients who are critically ill. For the rest, we seek your patience and understanding. The measures are necessary for our patients' safety and to contain the transmission as soon as possible. My Director of Medical Services, Associate Professor Kenneth Mak, will provide more information on the status of the cases later. We will continue to aggressively test and draw a wide ring around the cases so as to minimize the risk of further spread. We will carry out surveillance testing for patients who had been discharged from Tan Tock Seng Hospital, as well as those who have visited Tan Tock Seng on or after 18 April. We will also include those individuals who had been to or who work at the public places that the Tan Tock Seng cluster cases had visited during their infectious period. Our testing is ongoing, and we expect to detect more cases in the coming weeks, in the coming days. To reduce spread from undetected cases in the community, we will also close all public places visited by the cases during their likely infectious period for 2 days for cleaning, and this will also facilitate testing of the staff and workers at these affected areas. The Ministry of Health has reminded all our healthcare institutions of the need to maintain the highest level of vigilance for all staff and patients. Staff are regularly reminded of the need to strictly comply with the safe management measures and infection control prevention protocols, as well as to closely monitor their health and report if they are unwell, regardless of their vaccination status. We are monitoring this particular cluster at Tan Tock Seng Hospital very closely. The next few days will be critical. If we find many more cases that suggest widespread transmission, we will have to introduce more measures to break the chain of transmission. Minister Wong will share more later. These recent increases in cases is yet another reminder that the virus is alive and circulating, and we will have to continue to be vigilant because we remain vulnerable once we let our guards down. We must continue to be socially responsible and stick to the safe management measures, including for those who have been vaccinated. Let us continue to work together and remain vigilant and bring the local infections under control quickly. I'll now ask Associate Professor Kenneth Mak, DMS, to give a quick update of today's cases.
Thank you very much, Minister. As of the 30th of April 2021, the Ministry of Health has preliminarily confirmed 9 new cases of locally transmitted COVID-19 infection, of whom 8 are linked to previous cases. And amongst them, 4 cases are linked to case 62541. This is the regional index case which led us to detect the cluster of cases of infections in Tan Tock Seng Hospital. These were detected via proactive testing of patients and staff at Tan Tock Seng Hospital. Based on investigation so far, the cases are in the community and there are no new cases in the dormitories. In addition, there are 15 imported cases who have already been placed on a stay-home notice upon arrival in Singapore. And in total, there are 24 new cases of COVID-19 infection in Singapore today. Of the 13 COVID-19 cases in the Tan Tock Seng cluster, 5 are staff members and 8 are patients. The 5 staff include 2 doctors, a nurse, 1 healthcare assistant, and 1 cleaner who had worked in the ward where these cluster of cases has emerged. 7 patients were admitted to 1 ward in particular, that's Ward 9D, while 1 was admitted to Ward 9C. The cases have all been sent to NCID. They have been placed in isolation and they are looked after and cared for by our doctors and staff in NCID. All close contacts of cases are being placed on quarantine and have been swab tested. 4 wards in Tan Tock Seng have been locked down, and further information on the measures that have been undertaken in Tan Tock Seng will be provided by the Tan Tock Seng Hospital's CEO, Dr. Eugene So. We've also stepped up clinical surveillance of all inpatients who may develop fever or acute respiratory infections while in the hospital. All staff in the hospital have been reminded to adhere very strictly to infection control measures, and they've been placed on enhanced staff surveillance to pick up any symptoms and to report sick immediately for further evaluation. They're all also been advised to use their Trace Together app or token so as to facilitate any contact tracing should any of them become cases. The hospital has stopped receiving visitors except on a compassionate basis for patients who are critically ill, and they are not transferring any patients to other facilities or discharging until they've been cleared of infection. Staff and patient movements have been cohorted and restricted, with separate teams being assigned to look after different groups of patients so as to reduce any risk of spread of any infection within the hospital. We've also suspended non-essential training in the hospital, if only to mitigate any further concerns of spread that may take place beyond the hospital itself. The media release that we will issue will provide a full list of public places that cases that we've detected have visited during the infectious period, and to reduce the risk of transmission from this cluster to the general community, and also to reduce any spread from undetected cases that might still be present in the community. We recommend that members of the public, including staff who work in the hospital, who have visited these same public places, to monitor their health closely for the 14 days from the time that they may have visited the hospital. And if they are concerned about any symptoms that they may have, they encourage them to see a doctor. And in particular, if they visit one of our regional swab testing centers or PHPC, they would be eligible for government-funded swab tests. And this would help to allay any anxieties they may have about being potentially infected. NCID is further testing all cases that have been admitted to NCID to further characterize their status. They have been admitted and transferred to NCID on the basis of a positive PCR test. This may signify the presence of an active infection, but we also want to exclude other possibilities, and this may include patients who had previously been infected and persistent viral shedders, and therefore each case coming in would be tested further to characterize their status. The hospitals are also performing phylogenetic tests to assess whether any of these infections are due to viral variants of concern. But these tests take time, and the results are not expected to come out until the earliest next week, and they will give further information that would facilitate our epidemiological investigations. Of the staff, 4 of 5 have received vaccinations against COVID-19. 2 of the 8 patients have received some vaccinations. One had received 2 doses, whereas another had just received 1 dose. Those who have received vaccinations have derived some level of immune protection from the vaccines, but as is illustrated by this cluster, vaccination doesn't provide 100% protection, but it increases your resistance to getting symptomatic infection. It reduces the risk of you getting an infection and spreading that, and the vaccinations would remain protective for the wide majority of the population and staff who had received those vaccinations. We have carried out some preliminary investigations and will continue to study this to ensure that the vaccinated cases have been properly vaccinated. So far from our investigations, there are no issues with the quality of the vaccine that they've received, nor any concerns about the cold chain supply of vaccines to the vaccination centers where they had received the vaccination. It is certainly a possibility that these reflect vaccination breakthrough cases, but require further study before we can properly characterize them, and this is ongoing. We are working also with the other healthcare institutions, reminding them to remain vigilant in terms of the surveillance of patients who present with symptoms. They will also be looking out for visitors and patients to the hospital with a history of either being exposed to patients who have had COVID-19 infection, or in this particular case, who have had a history of visiting Tan Tock Seng for the period which we are concerned about. They will then assess each individual visitor or patient that comes to the hospital, and if need be, carry out further evaluation to exclude the possibility of any infection. They may remain ready to receive and treat any patient with COVID-19 infection. They all have COVID-19 beds and resources on standby, and those resources remain available. We have also asked them to be on standby to support Tan Tock Seng in its management of this outbreak, and if necessary, we will augment the hospital with additional resources to ensure that care of patients in the hospital is not compromised. Our concern is that the safety and welfare of patients is not undermined, and we are assured that Tan Tock Seng is doing all it can to keep patient safety upheld. So I'll let Dr. So provide further information concerning the measures that Tan Tock Seng Hospital has implemented to manage this particular outbreak. Thank you.
Dr. So?
Thank you, DMS and Minister. Our hospital has been working very closely with the Ministry to respond decisively to this situation. We have been in a pandemic mode since January 2020, and this virus continues to evolve and pose different challenges. This current situation is of concern, and we are acting fast with a three-pronged approach to contain, control, and to cast a wide net to secure the safety and well-being of our patients and staff. First, our immediate containment measures. Our hospital's priority is to contain the situation and to care for our patients and our staff who have been confirmed with COVID-19. We have taken immediate steps to treat and isolate them at NCID. Some of our patients are elderly and with multiple comorbidities, so we are monitoring them very closely. We have also identified inpatients and staff who are close contact of the positive cases. To date, we have transferred 61 patients, including the confirmed patients, to NCID. We have since also placed 76 of our staff who have been in close contact on leave of absence awaiting their quarantine orders. Based on further contact tracing, we anticipate that more staff will be placed on leave of absence as well as quarantine. In view of our manpower situation, we have worked closely also with the Ministry to reduce non-urgent electives and non-life-threatening A&E attendances during this period. I must emphasize that our epidemiological investigations are ongoing for the positive cases. We have locked down 4 wards, as you have heard from DMS, and other patients and staff in those wards have been swabbed. So far, the first swab results for these other patients are all negative. They are being monitored actively for their health and well-being. Second, our surveillance and infection control measures. We have stepped up clinical surveillance of all inpatients who may develop fever or ARI symptoms who are in flight. However, patients with COVID-19 may be asymptomatic, and hence this underlies the challenges with the diagnosis and surveillance of these patients. We have enhanced our staff surveillance and reminded our staff to be vigilant in twice daily temperature monitoring, and if unwell, to see our on-site staff clinic immediately and not to report to work. We have also reinforced infection control, hand hygiene, and PPE compliance for all our staff. We have enhanced our cleaning and disinfection process and increased its frequency throughout our hospital, including the wards that have been locked down. Third, we have cast our net wide to prevent further spread. As of yesterday, we have started mass screening for all inpatients and staff working in our wards. This is to cast our net wide in order to contain any potential and hidden risks. During this period, we have about 1,100 inpatients and 4,500 staff in our wards working across various shifts. This includes doctors, nurses, allied health professionals, housekeepers, and many other support staff. We will swab and test each and every one of them. All our inpatients will be swabbed by this evening, and all 4,500 staff will complete their swabbing by this weekend. As a safety measure for our patients and visitors, we are not allowing visitors into our wards till further notice. For those patients who are critically ill, we will allow visitors by exception on a compassionate basis, but we will monitor them and encourage them to take precautions as they see to their loved ones who are critically ill. While the above measures are to contain, control, and cast a wide net, we may pick up further cases, which we will quickly isolate and lock down the ward concerned. We have also mobilized our patient officers and welfare officers to support the well-being of our patients and the staff during this period. We will continue to work closely with the Ministry to contain and review our measures, and we will take further action as necessary. Thank you.
Good evening. We've been monitoring the infection situation around the world, and particularly in India, since we last announced some border measures. The situation, unfortunately, has continued to deteriorate, and we know that the infection is spreading beyond India to the surrounding countries. So we will be taking several steps to tighten our border measures. From 1st of May 2359, all long-term pass holders and short-term visitors with recent travel history to Bangladesh, Nepal, Pakistan, and Sri Lanka will not be allowed entry into Singapore or transit through Singapore. So we will be restricting travelers from these countries. Travelers with recent travel history in these countries who are already in Singapore and are presently serving out their stay-home notice will be required to serve out a full 21-day stay-home notice as well. That's for the interim, because these are already here, but beyond the 14 days, we will extend to the 21 days. But with effect from 1st May 2359, we will not allow anyone coming back or coming to Singapore with recent travel history from these countries, aside from returning Singaporeans and PRs. We will also tighten the border measures for Thailand. Thailand was when earlier we look at Thailand, the infection rates were sort of not as high, and so we allowed for travelers with recent travel history from Thailand to come into Singapore and serve a 14-day stay-home notice with the option to do so at home. But given that the situation in Thailand is also deteriorating and infection rates are rising, we will now tighten such that all travelers with recent travel history in Thailand will have to serve out the full 14-day stay-home notice in a dedicated facility. So these are the travel measures or the border measures which we are tightening given the latest assessment of the external environment. Beyond that, we will be taking additional steps to tighten our community measures in order to control this latest round of infection cases. You have already heard from Minister Gan and Dr. Eugene So just now about the steps that are going to be taken specific to Tan Tock Seng Hospital. Beyond that, you also heard, and I reiterate what Min Gan said, that for anyone who has been to the public places visited by the infected cases, for these public places, and there are a list of them, some of them are F&B outlets, some of them are places of worship, we will close them for 2 days for deep cleaning and to facilitate the testing of staff working at these places. Beyond that, for people who may have been exposed to these public places at the time when the infected cases were there, these are not the close contacts, because the close contacts would have been informed, notified, and we would have put them on quarantine. But through the Trace Together and Safe Entry system, we know that there are people who might be exposed because they were there in these public places at about the same time when the infected cases were there. So we will send SMSs to all of the people with possible exposures to notify them and keep them on alert so that they would monitor their own health, and if there is, they feel unwell, they can quickly see a doctor. In addition, we will also alert them and encourage them through the SMS to get themselves tested. So we'll send them instructions on where they could possibly go for testing, and the testing will be free of charge. This will also enable us to detect any cryptic cases quickly and enable us to control the infection better. Beyond these measures, we will do several other tightening of local measures. First, we will reduce the density of shopping malls. Remember, quite some time earlier, we had opened up and allowed for more people to enter the shopping mall, so we will tighten back and we will reduce the density. We will reduce the capacity limits for attractions. We will bring back the odd-even entry restrictions, odd-even day entry restrictions for some of the popular malls, and we will close all outdoor barbecue pits and campsites. So these are the additional measures we will put in place over the month of May in order to reduce activity levels and try and slow down transmission of the virus within the community. For workplaces, we encourage all employers to, as far as possible, allow their staff to work from home, and any social gatherings in the workplace should be avoided. The public sector will take the lead in this regard, and so agencies working in the Novena area, like the Ministry of Home Affairs and the Inland Revenue Authority of Singapore, IRAS, will be asking their staff to work from home where possible. For individuals, we also encourage everyone to do their part. Earlier this year, we had put in place the rule that for visitors to households, the number of visitors has to be capped at no more than 8 persons for the visit to the household. So that rule remains, and we should continue to comply with that rule. In addition, we ask everyone to limit your social gatherings to not more than 2 per day. In other words, if you are going out, be it to visit another household or to have a meal with your family or friends, limit such social gatherings to not more than 2 a day. As far as possible, aside from these limited social gatherings, stay at home, and if you have to go out, avoid crowded places. If you're not feeling well, then quickly see a doctor, get yourself tested. Do not go out, because that, you will run the risk of spreading the infection to wherever you're going. So be responsible. So long as you're not feeling well, even if it's a small bug, minor symptoms, get yourself tested as soon as possible. Also, for those who have been offered vaccination, if you are in the eligible group and you are medically eligible, we strongly encourage you to take up the vaccine. We know these new restrictions will create inconvenience for everyone. It's not easy because in the month of May there are 3 public holidays. We have May Day coming up tomorrow, Hari Raya later on, and then Vesak Day toward the end of May. I know many are looking forward to these public holidays. You would have made plans. You may want to gather together. You may want to socialize, meet your family and friends. But I seek everyone's cooperation to scale back your social activities and comply with all the prevailing rules. This is the only way we can ensure that we slow down the spread of the virus in the community. And we have to be mentally prepared too, that if the situation were to worsen, despite all that we are doing and despite all the new restrictions, if the situation were to worsen, we may have to consider further tightening and significantly reducing interactions in the community with more stringent measures. It's been about a year since we entered and then exited the circuit breaker. And since then, we have embarked on a path of reopening and resumption of activities. But from the very start, we have emphasized that this will not be a one-way street. There will be stops and starts, and there will be bumps along the way. We are encountering now one such bump in our journey of reopening. But let us also take confidence in the fact that today we have better capabilities and tools to control the infection. So if we stay disciplined and vigilant, and if we all do our part, I am confident we can get through this bump and get back on track towards our path of reopening the economy. So thank you very much.
Thanks. Let me just say that all these measures are very important that Minister Wong mentioned. But beyond these measures, what it reflects is actually a heightened level of risk of infection. We have worked together for the last more than a year, together with all Singaporeans. We have managed to keep the infection under control. And I want to take this opportunity to thank everyone who have helped us and who have tried their best to comply with all the measures so that we can get to where we are today. Now that we are seeing increased number of cases as well as a couple of clusters, there is clearly a heightened risk of infection now in the community. So we urge everyone to continue to work with us, to cooperate with us, observe the rules and guidelines that we are issuing, and in fact, go beyond that. If you can, where possible, reduce social interaction, social exposure, contacts, so that we can quickly bring the infection under control. So that even if we see clusters, we can contain the spread of the cluster, and so as to bring Singapore back to where we are, where we were before. So on this note, thank you very much, and now I would like to invite questions from the media.
Thank you, Ministers, DMS and Dr. So. We will now begin with the Q&A segment. Dear members of the media, please remember to use the raise hand function on Zoom if you would like to ask a question, and a reminder to keep to one question only. If you are called upon, you will be prompted to unmute yourself. Please do so accordingly. May we have the first question from Salma from ST, please?
Hello, thank you very much. Sorry, is there an echo?
You sound
I'd
okay.
like to-
Yeah, you sound okay to us.
Yeah, okay.
Right, I'd like to pose this question to Dr. Eugene So. Why is there a need to double the number of wards that are being locked down? And exactly what does lockdown mean? Does it mean the patients who are there, who may have recovered, won't be allowed to go home? And if they don't have COVID now, and if one person in the ward gets COVID, they are actually at risk of getting COVID if they are locked into that ward. And furthermore, what about the medical staff treating the patients in these wards? Are they a specialized, dedicated team? And how are they being protected, and how are their families being protected from possible exposure?
Yeah, thank you, Salma, for the question. When we lock down a ward, there is no in or out movement from that ward. So there is restricted movements for patients and staff, only for very essential testing. For example, they require a test in our radiology department. And even then, when we do move them, we take full precautions in moving them. But in all essence, there is strict restrictions on entry into the ward, so we will not admit any further patients into that ward, and we will have a dedicated group of staff taking care of those patients in the ward. So that is essential for us to put a barrier here to make sure that we keep the patients in the ward safe, as well as keep those outside the ward safe as well. So within the wards, there are enhanced infection control procedures. The staff take extra precaution in ensuring that they will care for these patients while protecting themselves. And we have to monitor them very closely, both our staff and our patients, so that we can pick up any spread very quickly and we can contain that as soon as possible. For the close contacts of the cases in those wards that have been locked down, for those close contacts, they will be transferred into isolation. Right? So they are not within the lockdown wards. The lockdown wards are for the other patients. And so far, the first swab testing that we've done for all the patients in those 4 wards have been negative so far. So we will have to continue to monitor them because they are not out of the risk period, and we have to keep them safe while we monitor them. So when we choose to lock down a ward, the decision is very much because there may have been some movement of patients, or there may have been a confirmed case in that ward. Earlier, DMS mentioned 9C, and that's why we have chosen to lock down 9C as well. And we will quickly then test all the other patients and move the close contacts into isolation immediately. So that's what happens with a lockdown ward.
Thank you, Dr. So. Can we have the second question from Tzu Peng of Taobao, please?
Hi, can you hear me?
Yes, Tupeng, we can hear you.
Okay, good evening, Ministers, TMS, and Dr. So. This is Zhipeng from Zaobao. First question would be, you mentioned that all public places visited by the TTSH cases will be closed for 2 days for cleaning. May we know it will be closed from which date to which date? And also, a couple of questions regarding the Tan Tock Seng Hospital cluster. We understand that the ICA officer's spouse is also a nurse at Tan Tock Seng Hospital. So how can we be so sure that there's no link between her and the TTSH cluster? And also, speaking of this cluster, it seems like the 57-year-old male patient was the earliest to display symptoms. So why was he transferred from Ward 7D to 9D when he already had these fever, cough, and runny nose symptoms? Thank you.
On the days, there are quite a number of places that are affected because these are the places that the infected cases have visited. We have them all in an annex in the statement. The agencies will be approaching the operators, owners of these venues to have them closed. And I presume most of it will be done over the weekend, Saturday, Sunday. In some instances, maybe not, but it will depend on the venue operators. But we'll want to do it as soon as possible, and we'll put out the notifications in due course.
I'll take the other two questions that you've raised. The first relates to a different cluster that arose linked to an ICA officer. I think there are still epidemiological investigations and contact tracing that are going on for that particular cluster as well. And it has been reported with that the wife of the officer, in fact, is a staff nurse working in the hospital. We've studied this so far, and we can't find any obvious link that links that particular nurse to the current cluster we're looking in Tan Tock Seng in terms of where she's gone, where she works. It doesn't appear as if it overlaps with the movement of patients or the other staff that we've now detected as part of this cluster in Tan Tock Seng. So it doesn't appear at this stage that they are actually linked. But on an abundance of caution, the ward where she had previously been at is included in the list of wards that have been locked down with the purpose of ensuring that we have tighter surveillance. We screen and test all the staff and patients in that ward just to ensure that we're not missing anything. The investigation is still ongoing. I mentioned earlier that we are carrying out phylogenetic studies for all patients who present with a diagnosis of COVID-19 infection. And this will provide additional data that will allow us to determine whether her source of infection, in fact, is linked to the same outbreak that we're seeing in Tan Tock Seng. It may not be so. They may be really very distinct, two different clusters. But we're keeping an open mind. The investigations still continue. And on an abundance of caution, that ward where that nurse had been is included in our sweep and the measures we're taking in Tan Tock Seng Hospital. You asked also about 7D and 9D. And one particular patient who had actually moved there. My understanding, Dr. So can further elaborate if need be, was that this patient was admitted to the hospital initially and then was kept under observation in one of the wards. But when a bed was available in the definitive care wards, that patient was then subsequently transferred to that particular bed. And that explains why initially the patient spent just a day in 7D and subsequently spent the rest of the hospital stay within 9D. And again, on an abundance of caution, we've included 7D, even though he had spent less than a day, in fact, in that particular ward. And we're testing all staff and all patients in that ward just to assure ourselves that there is no spread of infection to that particular ward. And so far, the testing of both staff and patients in that particular ward has not yielded any positive results. So we continue to be vigilant and we continue to watch to see whether or not there will be more cases that come out through our testing exercise.
Thank you, Minister and DMS. Can we have the third question from Si Hui from CNA, please?
Hi, this is Si Hui from CNA. I have two broad questions. The first one will be related to new infections. The new infections, those that are recovered or vaccinated, connected to new virus variants that we see in India, as well as how many vaccinated people in total got infected, even though they got vaccinated, and will this have an impact on the vaccination drive? Now, the second broad question would be, remember we talked about the unique visitors the rule of 8 unique visitors and being able to visit 2 households daily. Will there be will there be an increase in enforcement numbers? How are you going to enforce this new rule? Will there be a penalty for violators? Thank you.
Thank you very much for your questions. I'll take the first few questions concerning viral variants of concern and the issue of vaccination. At the last press conference, I had given an update and an overview on the cases that we've seen that we've identified linked to viral variants of concern. We continue to test all COVID-19 infected cases to determine whether there are other viral variants of concerns isolated. But that continues to be testing in progress, and as you can see, as cases come in, there will be more tests that are done. We're not ready to provide a further update because we still need to compile that additional information, but we hope then to give you more information as that information becomes available. So we are looking even for the existing clusters in Tan Tock Seng Hospital and the other clusters to determine whether any of them are due to viral variants of concern. This would be obviously a matter of great interest to us because we've noticed that there were several doctors and nurses, healthcare workers in Tan Tock Seng who have had their vaccinations and now have been found to have infection. We are looking into the possibility that this could be related to a breakthrough infection occurring in vaccinated people. But the evidence to date suggests that the wide majority of vaccinated people continue to have protection. And when we reflect on the overall number of people who have been vaccinated, we think that vaccination still is important, still is recommended, and we still encourage as many people to get vaccinated to improve their level of immune protection against getting infection, and if infected, getting a severe infection. So it remains our recommendation to encourage everyone to still get vaccinated. And we believe that that vaccination will continue to protect us, even though we're seeing a few cases that may reflect a possibility of breakthrough infections in vaccinated people.
I'd like to just echo what DMS said just now about vaccinations. I mean, we always knew that vaccinations are not 100%. That's nothing new. The fact that breakthrough infections can happen is something we already knew about. So we should not, overreact to the news of breakthrough infections, or worse, make the biggest mistake, which is to say that, vaccinations don't work and therefore maybe there is no need for a vaccine. I think that would be disastrous because the vaccinations do work. They protect yourself, first of all, from the risk of severe disease, and they do help to reduce transmission. It's not 100%, but there is an impact. And the more of us who are vaccinated, the bigger the impact will be in reducing overall transmission of the virus in our community. So once again, we really encourage everyone who's medically eligible or who are in the age groups to get yourselves vaccinated. Make a booking if you have not done so already. On the other question on the rules for visits, the 8 unique visitors per day rule has been in place for some time. We will continue to apply that and enforce that. The outgoing visits, 2 per day, we are now saying limit to 2 social gatherings per day, whether it is to visit a household or for a meal or for a gathering in any public place, limit to 2 per day. We will continue to enforce to the best of our abilities. It's not new, we've done this before over the course of the last few months and even through the Chinese New Year period. So we will do whatever we can to step up enforcement for these rules as well as for all the other safe management measures that are in place. And we will not hesitate to take enforcement actions against anyone who is in breach.
Thank you, Minister and DMS. May we have the next question from Philip of Bloomberg, please?
Hello, I hope you can all hear me okay. I had a question about India, actually. Perhaps you've heard that India is now withholding their supply of vaccines. And I'm not sure if, I was wondering if this impacts Singapore in any way whatsoever. For example, if they were in negotiations to perhaps procure vaccines from India? And if so, I wonder what your take on that move by India is. And lastly, I wanted to ask Minister Gan, given your
Sorry,
recent-
Philip, to interject. We couldn't hear your question. Could you repeat?
We lost you for a
yourself? Yeah,
while.
we lost you at some point.
Sorry, can you hear me better now? Is it
Yeah,
better?
it's better. Yeah, just speak closer to the mic, please.
Yeah, sorry. Just given the situation in India, perhaps you've heard that they've withheld, they're going to withhold vaccines there. I wonder if that impacts Singapore in any way whatsoever. For example, if you had negotiations to procure vaccines from India, and if there is any impact there, what your take on that would be. And the second question for Minister Gan, given your recent appointment, I wonder if this is your farewell party from MTF.
On the vaccine situation, there's no impact from the move by India, but we have always said, whether it's India, whether it's Europe, whether it's whatever country that imposes restriction on exports potentially, we recognize that there may be delays or disruptions to our vaccine supplies. So the risk will always be there. But for now, we are still getting our supplies of vaccines, and we are continuing with our vaccination program, and we will manage the risk by diversifying the types of vaccines we use. We have 2 vaccines now, and we are continuing to look for other options.
On the vaccine, let me just also add that we remain focused on getting the whole of Singapore vaccinated by the end of this year. So far, we remain on schedule to achieve that. And hopefully, we do not see further delays or disruption, and we will be able to achieve that objective. As far as I'm concerned, for as long as I remain a health minister, I will remain focused on COVID-19 and working with my co-chair, Minister Lawrence Wong, and the team to work to contain the infection and to keep Singapore safe.
Thank you, Ministers. Can we have the next question from Sing Hui of SCMP, please? Hi, Sing Hui. Sorry, we can't hear you.
Oh, hello. Hi.
Yes,
Sorry.
it's okay now. Yeah, please repeat the question.
Hi. Good evening, Minister. So I understand that when we announced the travel bubble on Monday, the suspension mechanism only looks at unlinked cases over a 7-day moving average. But given the developments in Singapore right now and how we have also tightened the measures within the community, would worsening cases then also affect this travel bubble?
Well, there is, as you highlighted, Sing Hui, a threshold that both sides have agreed upon based on the moving average over 7 days of unlinked cases. So we will continue to apply that mechanism. If it breaches the threshold in Singapore, then the travel bubble may not start. Or if it starts, but along the way, the threshold is breached, then it may well be suspended. So as I had said just now, and even the last conference when we talked about this, we just have to be mentally prepared that this is not a situation where new initiatives are rolled out and then they will continue permanently without any potential for disruption. Because the situation is so fluid, it's highly unpredictable. There will be ups and downs in our infection controls from time to time. Even a single case can very quickly result in clusters forming. So we just have to be mentally prepared that from time to time the thresholds will be breached and potentially there will be suspensions along the way.
Thank you, Minister. Can we have the next question from Yong Shen of Channel 8 News, please?
Hello, panelists. Can you hear me?
Yes, we can hear you, Yong Shen.
All right. I got some questions. Basically, I just wanted to, because just now we mentioned that, there will be people from TTSH that will be put on LOA and quarantine. So first question would be how many of such manpower is expected to be reduced? Also, based on the stats mid-month this month,
there are close to about 2,500 A&E cases in TTSH. So how many percent of these new A&E cases will be rediverted to other hospitals, and how do you determine which hospital will be sent to, whether the A&Es from other hospitals can cope, and also whether there's any prevention of cross-interaction between the hospitals and or health group protocols have been activated?
Eugene?
So I'm going to take the earlier question about the number of staff we anticipate that will be put on leave of absence as well as quarantine. I think the investigations are ongoing at this stage, and we are doing further contact tracing. So we do anticipate the numbers to go up. Today we have 76 of our staff who are already on leave of absence, but we do anticipate to be in the 100 or more by the time we finish our full contact tracing. So I do anticipate a couple of hundred would be possibly put on leave of absence. In order to manage our manpower, therefore, we will have to therefore reduce electives. We are reviewing our outpatient clinic schedule as well to reduce the number of appointments. The less urgent appointments will be rescheduled beyond these 2 weeks in order for us to cope by redeploying our manpower to essential areas that require operations. We have also worked with the ministry to look at non-life-threatening ambulance cases coming to our hospital. And for that, I will leave it to the ministry to share with you as to how they would do the ambulance diversions.
Thank you, Dr. So. Indeed, the Ministry of Health works closely with all our hospitals, as well as the Singapore Civil Defence Force, to ensure that patients who have urgent need to get to hospital are evacuated for timely care. But where we evacuate them to would vary depending on where these patients come from and which the nearest hospital is. But we also monitor how busy the hospitals are, their emergency department, their bed occupancy status, and we have on occasion issued guidance to preferentially direct patients to be evacuated or transferred to certain hospitals to ease the load on others where they are particularly busy. And since the weekend, we've in fact been preferentially diverting ambulance transfers and evacuations to other hospitals away from Tan Tock Seng. This was not a measure that initially started due to this particular cluster, but we had noticed that there was a high bed occupancy rate in Tan Tock Seng, and we had worked out a temporary arrangement to bring more patients to the other hospitals in order to ease the load on Tan Tock Seng, and it fortuitously occurred at a time when we first detected this cluster. We've continued this particular arrangement, if only to provide some breathing space for the hospital, Tan Tock Seng, to reduce the number of patients that require admission in, and therefore allow the hospital to focus on managing this outbreak and ensuring that the existing patients within the hospital are looked after properly with their safety upheld. We are monitoring the situation in all our hospitals, and in particular the other hospitals where they have received patients which otherwise might have been transferred or evacuated to Tan Tock Seng Hospital. The hospitals have reported an increased number of patients presenting to their emergency departments, but at this time, the volume of patients that present is still manageable, and we will continue to monitor this closely and work out arrangements where necessary to ensure that the system can cope. To further expand, we do have an overall bed capacity that still is sufficient to meet our current needs, including the clusters that we have at hand. And that includes not just the Tan Tock Seng cluster, but also the other cluster of cases that we've seen and have been reported as well. We also have our stock of COVID dedicated beds in all our hospitals. They all remain on standby, ready to be activated for use, both general ward beds and ICU beds, and the manpower, if need be, to be stood up to support looking after COVID patients in all our hospitals. So these are the reserve measures that we've had ever since last year. they remain in readiness. But at this time, we have not activated any of these other reserve measures just yet.
Thank you, DMS and Dr. So. Can we have the next question from Eugene of Today?
Hi, I have a couple of questions. So we know that vaccinations cannot fully prevent infections, but do we know how severe the symptoms are amongst those who have been infected, even though they have been fully vaccinated? The second question I have is, for patients who have just received just one dose of the vaccine, will they continue to be vaccinated with the second dose while being infected? For the Westlake Dorm and Tan Tock Seng clusters, they both involve fully vaccinated individuals. Do we know if these vaccinated persons were the index cases for their clusters? And a final question, how does the impact on Tan Tock Seng Hospital affect Singapore's overall healthcare capacity? So are we effectively sending patients and staff to other hospitals? So for instance, I think during the SARS period, several hospitals were also infected after there was a Tan Tock Seng outbreak, and patients were sent to other hospitals. Thank you.
Thank you very much for the question. First of all, just to state, you asked about severity of infection. Those who are vaccinated, the staff members in particular, and those who are detected to have COVID-19 infection, they've either been asymptomatic or at best had very mild symptoms. So the case in point was that first staff member, the nurse, which brought a series of screening actions that then picked up the other cases. She had very mild respiratory symptoms, but in fact many of the other cases have been asymptomatic, and that is consistent with our understanding that vaccinations do help to prevent or reduce the likelihood of severe infections occurring. It's more difficult to look at patients and to assess whether or not infection is severe in them, because you have to remember these patients were in the hospital for a variety of different medical conditions, and those medical conditions might already lead to them being quite ill. Some of these patients are very senior in their age. We've got patients in their 90s, frail with concurrent multiple medical conditions, who already are very ill, and where the families have been engaged even before detection of infection to let them know that in fact they need to be prepared that these patients might get worse as a result of their original condition. So because of this, it's a bit difficult for us now at this stage to assess whether or not they have a worse prognosis on the basis of the infection. But we continue to be committed to look after them, to provide as best care as we can, and we're committed to providing as much support, not just to the patients, but also to their families during this very difficult time. We are mentally prepared that some of these patients may not do so well, given how old they are, how frail they are, and the medical conditions that they have. But we continue to hope for the best, and we are committed to provide as best care as we can for all the patients in the hospital. You've asked also about whether, as a result of the outbreak, the capacity that we have in Tan Tock Seng, as well as in other hospitals, will be challenged, and whether or not we'll be able then to provide healthcare services as a result of dealing with these outbreak and the patients that need to be admitted. I had mentioned earlier that we monitor this very closely, and at this time we still have sufficient bed capacity, both in Tan Tock Seng Hospital as well as in the other hospitals, to deal with the anticipated number of patients that we might see coming out from this cluster, as well as dealing with other clusters that may arise in the community and other patients who require care for their medical condition. So at this stage, at this time, we remain confident that we have sufficient healthcare services and resources to accommodate the needs of our population, but we will continue to be vigilant and monitor this very closely. We have reserves as far as resources, beds, and equipment, and we stand ready, if need be, to activate them, but we have not identified the need to do so at this stage.
Thank you, DMS. Can we have the next question from Kang Wei of Wanpao?
Hi, panelists. Can you hear me?
Yes, we can hear you, Kang Wei.
Hi, good evening, panelists. So what we see today is there have been a lot of additional measures taken for Tan Tock Seng Hospital. So like the decision to clear public places visited specifically by this case and testing like most of the patients in the hospital and allowing members of public visiting this place to be tested. So I think these are actions that have not really been taken in the past. I think it's quite drastic measure this time now. So is there any reason why such drastic measure is taken for this Tan Tock Seng Hospital cluster? Is it because there is a virus variant that's more transmissible than what we see in the past? And will MOH actually consider stepping up measures for all hospitals such as this as well, such as tightening of ward visiting policy or restricting movement of doctors across different hospitals?
We remain vigilant to look to see whether or not there's any possibility that there will be other cases that go to any of our other hospitals. All our hospitals have been instructed to check on their processes to make sure that they are vigilant, disciplined, and strict with infection control within their hospitals, and that we are monitoring the situation very closely. We have not engaged all the measures that we could have done, but we've decided that we will impose or implement more stricter measures in Tan Tock Seng simply because this is where the current outbreak is. And we will monitor this on a day-to-day basis to decide whether or not we can lighten up on these restrictions or whether or not further adjustments in terms of some of these restrictions need to take place. The restrictions that we're putting in place in the community is not simply as a gut reaction to what is happening in Tan Tock Seng Hospital. But over time, as we see our community cases coming down, we are also concerned that within the community, that we may not be so vigilant, so disciplined in our use of mask wearing, safe distancing measures, and there's always the risk that we may become complacent. So the fact that we now have to impose some of these additional measures compared to previously when we were lightening up is also a message that we want to give to all of us in the community, that we must remain vigilant. And that everyone's participation in this makes a big difference to how we can remain resilient and protected against this particular infection. And as Mr. Wong has mentioned earlier, there may be some ups and downs, and there may be a need from time to time to tighten some of our measures, but at other times to loosen and lighten up. But at all times, we must not be complacent, and this is clearly a lesson that we must learn.
I should just add too that this is the first time in quite some time that we have seen relatively larger clusters emerging in the community. So obviously it is cause for concern, but we have also learned from experience that in order to control and break the transmission chains, we must move in quickly to try and stop the transmission from spreading further. We now have better tools to do this. We have testing capabilities, we have a better tracing system using Trace Together and Safe Entry. So we are essentially using everything at our disposal to try and slow the infection, keep it under control, and break the transmission chains.
Thank you, Minister and DMS. We will now take the last two questions. Next, can we have Sandra from ARD German TV, please?
Good evening. What do you know about the origins of the hospital cluster? How did the first case get infected?
Thank you very much for your question. Epidemiological investigations are still ongoing, so we are not able to give you a good response at this point in time who might have been the first case and where infection might have occurred. We do know that the first case that presented to us was a nurse who, as a result of the rules that the measures and the protocols are being in place in the hospital, when she started developing mild respiratory symptoms, she immediately reported her symptoms and sought care. And that allowed us then to detect the infection and then start doing contact tracing and testing more people, staff and patients. But she may not be the original patient that was infected, nor the cause for other patients and staff to be infected as well. So we keep open the possibility that infection may have been introduced into the hospital by someone else. It could already be one of the staff or patients that we have already detected, but it could easily be someone else that we have yet to detect, but may detect over the next few days of testing. So we continue to investigate every single case. We carry out both PCR and serology testing, and we try to assess whether they're symptomatic or not, and when their symptoms arose, with a view towards trying to determine who might have been the earliest person to get symptoms or get infected, and that plausibly might then be the first case that introduced infection onwards. But as of now, that contact tracing and epidemiological investigations are still ongoing, and we are not able to provide you with a definitive reply as to who might have been the first patient to introduce infection into Tan Tock Seng Hospital.
Thank you, DMS. The final question comes from Radhana from Reuters, please. Hi, sorry, we can't hear you. Could you unmute yourself?
Hello.
Yep.
Hi. Minister Wong, maybe this one is one for you. Just wondered, are we looking at some kind of thresholds in number of cases, unlinked cases, as you are looking to, as we look to tighten further if needed?
Well, this is an ongoing exercise. We've been through this before, through the course of the whole year last year, where we continue to monitor infection rates on a daily basis, particularly the unlinked cases in the local community. We continue with our sentinel surveillance, where we test everyone who sees a doctor with acute respiratory symptoms. And then we look at a whole range of other indicators to assess the compliance with safe management measures, for example. And based on that, we calibrate the measures that we have in place. So as I said just now, we've put in place a set of tighter measures that we believe are necessary to slow down the infection and to break the transmission chains. But we have to be mentally prepared that if the situation does not improve and instead continues to worsen over the coming days, then indeed we will not hesitate to take tougher action, which would include more stringent measures that will reduce significantly the number of interactions within the community, because ultimately that's still the best way to break transmission chains, where you slow down interactions or you significantly reduce social interactions and we restrict movement. And when that happens, then you quite quickly are able to bring the infection under control. We are not there yet, but we strongly encourage every individual, everyone in Singapore to do their part, stay alert, be vigilant, and hopefully, as I said, we will be able to get through this bump together.
Let me conclude by once again thanking Singaporeans for helping us, for working with us over the last more than a year, and let's continue to work together to keep this under control and continue our journey of a safe opening. I also want to take this opportunity to thank all our healthcare workers who have been working very hard, particularly healthcare workers in Tan Tock Seng Hospital. They need to work even harder during this period of time because we have put in place several additional precautionary measures to strengthen the prevention of this transmission. And some healthcare workers in Tan Tock Seng have also been quarantined, and therefore the manpower supplies have come down and they have to work doubly hard. So I want to take this opportunity to thank all of them for contributing and being committed to taking care of our patients. So once again, thank you.
Thank you, Ministers, DMS, and Dr. So for your time. And thank you, everyone, for joining us today. We have come to the end of the press conference. At the time now is 6:48 p.m. The embargo is now lifted.